The Weight of Waiting, Mr. Henderson's story. Mr. Arthur Henderson was 82 years old. He lived a quiet life in a modest suburban home, the same one where he and his late wife, Eleanor, had raised their children. His days followed a simple rhythm: a morning walk, if his hip allowed, tending to his small vegetable garden and reading history books in his comfortable armchair. Eleanor had been gone for 5 years, and her absence was a constant, quiet ache. Lately, a new worry had begun to cloud his peaceful routine. A persistent, nagging pain in his chest, sometimes accompanied by a frightening breathlessness, had started to intrude more frequently upon his days, a stark reminder of his aging body and its vulnerabilities. The doctors at the local clinic were kind, but spoke in serious tones. They mentioned tests, specialists, and potential procedures. One cardiologist suggested that Mr. Henderson might need an angiography and possibly an angioplasty to address a suspected blockage in his coronary arteries. The words themselves sounded expensive, complex, and daunting to him. He nodded, trying to absorb the information, but his mind kept drifting to a more immediate, practical concern. How much of this would his insurance actually cover? He knew his Medicare plan had limitations, and he had a supplemental policy, but the details were a confusing maze of deductibles, co-payments, and coverage gaps that he never fully understood. This uncertainty about insurance reimbursement became a heavy weight. It was a hidden cost, not listed on any medical bill, yet profoundly impacting his well-being. He found himself hesitating to schedule the follow-up appointments. Each twinge in his chest brought not only physical discomfort, but also a wave of financial anxiety. Would the treatment that could ease his pain, perhaps even save his life, be financially ruinous? This question loomed larger than the medical diagnosis itself. He worried about depleting his small savings, the money he had carefully set aside, hoping to leave something for his grandchildren, not spend it all on his failing health. The stress began to affect his sleep and his appetite. He would lie awake at night, replaying the doctor's words and picturing stacks of bills. This was the reality for many elderly individuals. The fear that necessary medical care might be just out of reach, not because it wasn't available, but because the complex dance of insurance reimbursement might leave them stranded. Mr. Henderson's predicament was not unique. It was a silent struggle faced by countless seniors navigating the intricate and often unforgiving landscape of healthcare financing in their later years. A struggle that could mean the difference between timely care and dangerous delay. The price tag on health, why insurance matters. Medical treatments, especially those required by older adults, carry astonishingly high price tags. Consider the cost of a cardiac procedure like the one Mr. Henderson might need. It can easily run into tens of thousands of dollars. Cancer treatments, joint replacement surgeries, or even the ongoing expense of managing chronic conditions like diabetes or heart disease with multiple medications can accumulate to overwhelming sums. These are not minor expenses that can be managed by trimming the household budget for a month or two. For many, these costs represent several years of income or far exceed their entire life savings, making them utterly unaffordable without substantial assistance. For an elderly person living on a fixed income, perhaps relying on Social Security and a small pension, these figures are terrifying. Out-of-pocket expenses of this magnitude are simply impossible to bear. Mr. Henderson, for example, received a modest pension and his Social Security benefits. After covering his basic living costs, mortgage, utilities, food, there was little left over. The prospect of facing medical bills that could dwarf his annual income was a source of profound dread. This is precisely why health insurance is not a mere convenience or a financial product like any other. It is an absolute lifeline, a fundamental necessity for accessing modern medical care without facing financial ruin. Insurance, in theory, is designed to pool risk and provide a buffer against catastrophic expenses. It's a promise that when illness strikes, the financial burden will be shared, making essential treatments accessible. For seniors, programs like Medicare in the United States offer a crucial safety net covering a significant portion of healthcare costs. However, as Mr. Henderson was discovering, significant portion does not mean all. Gaps in coverage, deductibles, co-insurance, and the cost of prescription drugs can still result in substantial out-of-pocket payments that many elderly individuals struggle to afford, even with supplemental insurance plans designed to fill some of those very gaps. Without adequate insurance reimbursement, the path to treatment becomes fraught with peril. Patients may be forced to make heartbreaking choices, such as foregoing necessary procedures, skipping medication doses to make prescriptions last longer, or delaying doctor visits until a condition becomes a crisis. This is not a hypothetical scenario, it is a daily reality for many. The ability to afford care directly linked to the adequacy of insurance coverage and reimbursement becomes a primary determinant of health outcomes. For elderly patients like Mr. Henderson, clear and comprehensive insurance is not just about financial security. It is, quite literally, about their health, their quality of life, and their survival. Two neighbors, two systems healthcare in the US and Canada. The healthcare system in the United States is a complex tapestry woven from private insurance, employer-sponsored plans, and government programs like Medicare and Medicaid. Medicare, specifically for those aged 65 and older, provides essential coverage. But it is not all-encompassing. Patients often face significant out-of-pocket costs from premiums, deductibles, co-payments for services, and notably prescription drugs, which can be extraordinarily expensive. For Mr. Henderson, navigating Medicare and his supplemental plan involves understanding intricate rules about what is covered by whom and how much he will ultimately have to pay. The reimbursement process can be opaque, and approval for certain treatments can sometimes be a battle. Across the northern border, Canada operates under a predominantly publicly funded universal healthcare system, often referred to as Medicare. This system is guided by the Canada Health Act, which ensures that all residents have access to medically necessary hospital and physician services without direct charges at the point of service. Funding comes from taxes, and care is delivered by private providers, with the government acting as the single payer for core services. For an elderly Canadian in Mr. Henderson's situation needing an angiography, the concern about personal cost for the procedure itself would be largely alleviated. The reimbursement for the doctor and hospital would be handled between the provider and the provincial health plan. This fundamental difference in funding and coverage profoundly impacts the patient experience, especially for the elderly. In the US, an individual's access to care and financial burden is heavily tied to their specific insurance plan and its reimbursement rates. They might have more choices in terms of specialists or speed of access for some procedures if they have excellent, comprehensive insurance, but they also face the risk of financial hardship if their coverage is inadequate. In Canada, while patients may sometimes experience longer wait times for elective procedures or have less choice of specialists in some areas, the fear of financially crippling medical bills for essential services is largely absent. The system prioritizes universal access over market-driven choice for core medical needs. So if Mr. Henderson lived in Canada, his primary worry about his chest pain would likely be medical, not financial. He would consult his doctor, be referred to a cardiologist, and undergo necessary tests and procedures with the costs covered by his provincial health insurance. He would not be scrutinizing policy documents or dreading bills. While no system is without its challenges, Canada grapples with wait times and resource allocation. The Canadian model offers its elderly citizens a greater degree of financial peace of mind when it comes to essential health care. The American system, while offering cutting-edge technology and choice for some, can leave its elderly vulnerable to the harsh realities of high costs and insufficient reimbursement. The unseen scars consequences and a call for care. When insurance reimbursement falls short or when coverage is simply insufficient, the consequences for elderly patients can be devastating, extending far beyond financial strain. The most immediate impact is often delayed or foregone care. An older adult, fearing high out-of-pocket costs, might postpone a crucial doctor's visit for a new symptom. Like Mr. Henderson initially hesitated, they might try to ration expensive medications, taking half doses to make a prescription last longer or skip refills altogether. These decisions, born out of financial necessity, are gambles with their health, gambles that can have dire repercussions on their well-being and long-term prognosis. Delaying necessary medical attention allows illnesses to progress. A manageable condition can escalate into a far more serious, complex, and ultimately more expensive health crisis. A small, treatable tumor, if ignored due to cost concerns, can grow and spread, drastically reducing treatment options and chances of survival. A heart condition, left unmanaged, can lead to a debilitating stroke or a massive heart attack. The irony is that avoiding care due to cost often leads to much higher healthcare expenditures down the line, not to mention irreversible damage to health and a significant decline in the quality of life remaining for these individuals. This is a tragic and preventable cycle. Consider Mrs. Davis, a contemporary of Mr. Henderson. She too faced a cardiac concern but had a less comprehensive supplemental plan and smaller savings. Frightened by the potential co-payments for diagnostic tests, she put off seeing a specialist for nearly a year, attributing her fatigue and shortness of breath to just getting older. By the time she finally sought advanced care, her condition had severely worsened, requiring more invasive and risky surgery than if it had been caught earlier. Her recovery was prolonged and difficult, and she never quite regained her former vitality. The unseen scars were not just physical, they were the lost months of better health, the added anxiety, and the diminished quality of her final years. Accessible healthcare, undergirded by fair and comprehensive insurance reimbursement, is not merely an economic issue, it is a moral imperative, especially for our elderly population. They have contributed to society throughout their lives, and they deserve dignity, security, and the best possible care in their later years. The hidden costs of healthcare, the fear, the stress, the impossible choices, the declining health from delayed treatment, are too high a price for any individual or any society to bear. Ensuring that financial barriers do not stand in the way of necessary medical treatment is fundamental to a just and compassionate community, a true measure of our collective humanity.